Hey viewers, today we discuss about sideroblastic anemia. Here you can see the structure of normal RBC and the sideroblastic RBC. Okay, now what is sideroblastic anemia? Sideroblastic anemia, it is a disorder that is characterized by defective heme synthesis leading to iron accumulations in mitochondria of erythroblast forming ring sideroblast. That means normally heme synthesis is done by using the iron, but when this iron getting accumulated in the mitochondria of erythroblast cells, that time this accumulated iron in the mitochondria or excess iron containing mitochondria create a ring like structure, that is ring sideroblast, that also known as the ring sideroblast. And this type of conditions may lead to malformations or immature formations or deficient formation of hemoglobin that ultimately leads to sideroblastic anemia. Here you can see normal heme synthesis. Normal heme synthesis happen iron plus protoporphyrin that may create heme with the help of enzyme synthase. That is the vitamin B6 dependent enzyme. Its defect of this enzyme leads to impaired hemoglobin synthesis. Here the pathway of normal heme synthesis, glycine plus succinyl-CoA create aminolevulinic acid. Then this aminolevulinic acid converted porphobilinogen converted protoporphyrin 9 with the help of cofactor Fe2+. This protoporphyrin 9 converted into heme. If the defect happens of this aminolevulinic acid synthase enzyme and vitamin B6, that time iron cannot be incorporated into the hemoglobin and may leads to the accumulations of hemoglobin in the mitochondria of the erythroblast cells and the ring sideroblast getting formed. Now, mechanism of formations. How this ring sideroblast getting formed? Defect in heme synthesis, iron cannot be incorporated into the heme, iron getting accumulated in the mitochondria of the erythroblast, and that may form of ring sideroblast in the bone marrow, that leads to ineffective erythropoiesis. In this case, erythropoiesis happens, but the erythropoiesis will be ineffective erythropoiesis. Here the mechanism of ring sideroblast formations: defect in heme synthesis, aminolevulinic acid synthase 2 enzyme that decrease protoporphyrin productions. If the protoporphyrin production getting decreased, iron cannot bind to the heme, bind to form heme. Iron getting accumulated in the mitochondria of erythroblast, formation of ring sideroblast around the nucleus, ineffective erythropoiesis, and that may lead to destructions of immature RBC in the bone marrow, and the iron overload happens in the RBC but not in the heme, and the anemic conditions will be happens. What will be the pathophysiology of this sideroblastic anemia? Ineffective RBC production happens. That means RBC production normal, but the RBC are ineffective. Iron overload despite anemia, mitochondrial iron deposition. If you see the structure, their ring-like structure happens in the erythroblast cells or erythrocytes due to the excess iron accumulations in the mitochondria. Oxidative damage of erythroid cells. This type of damage happens when happens in the erythroid cells, that may inhibit the productions of erythrocytes, result in the microcytic or dimorphic anemia. Now here are several causes. Now first causes is congenital causes, that is X-linked mutations of the aminolevulinic acid synthase 2 gene, defect in the synthase aminolevulinic acid synthase enzyme seen in the male, present early in the life. This is the congenital causes. Next one is the acquired causes: alcoholism, lead poisoning, vitamin B6 deficiency, defined drugs like isoniazid, chloramphenicol, etc., myelodysplastic syndromes. These may lead to ultimate sideroblastic anemic conditions. Here are some symptoms of sideroblastic anemia, like muscles getting fatigue and weakness happens in the body. Pallor happens. Pallor can be seen in the RBC erythrocytes, shortness of breath, iron overload symptoms that also known as the hepatomegaly, cardiac complications in severe cases due to lack of oxygen transport. Laboratory diagnosis, how we can diagnose the sideroblastic anemia, peripheral blood smear, the RBC getting microcytic and dimorphic shape. Bone marrow ring sideroblast happen if we stain with Prussian blue stain. We can see the ring sideroblast in the bone marrow. Serum iron level increases, ferritin level increases, total iron binding capacity normal or maybe decreases. Here the structure you can see ring sideroblast around the nucleus, the excess iron getting accumulated in the mitochondria around the nucleus and form the ring like structure. Okay, now special investigations like bone marrow examinations is the confirmatory test for the sideroblastic anemia. Genetic testing for conformational forms, like if the disease for the X-linked disorder, that time genetic testing is required. Liver function test, iron overloaded, liver function test to be done to investigate the iron overload. Serum vitamin B6 level also be estimated. Okay, now here are some treatment. Pyridoxine treatment, that means vitamin B6 therapy. Remove causative agents like alcohol, drugs, blood transfusions if severe conditions happens. Iron chelation therapy in overload cases. Treat the patient's underlying disease according to their symptoms. Now here are some preventions. Avoid alcohol abuse, proper drug monitoring, nutritional supplementation like vitamin B6 supplementation, early diagnosis in high risk individuals. Here are some summary. This sideroblastic anemia, it is due to defective heme synthesis that leads to iron accumulations in the mitochondria and ineffective erythropoiesis. Diagnosis mainly by bone marrow ring sideroblast. Treatment depends on causes and vitamin B6 responses. Thank you.